Welcome to Health Stealth Radio, where we move away from the mundane to gather insights from the shadows of enterprise and patient cybersecurity. Yes, we surely believe that traditional themes like endpoint software and zero trust are critical, but given massive advances in AI, remote and wearable device hacking, and data hostage negotiators, there's a much darker side to cybersecurity, and not everyone is quite willing to talk about it in public. Health Stealth Radio will thrive on these topics and encourage fireside spats to debate them. Here's your host, Frank Cutitta.
Good afternoon. My name is Frank Cutitta. Welcome to Health Stealth Radio. It's always a pleasure to have the two characters I have with me today, who are my colleagues at CHIME and also just very well known in the government relations community. And I think somebody's a Baldrige Award winner as well. So I think we've got that to add to the introduction. So if we could just do a brief introduction with Mari and Chelsea. What's the difference in terms of how you both approach your work in a typical day, or does it duplicate? I mean, what are the differences between Chelsea and Mari's job description?
I would say we're very similar, but I am more diving into the policy, the actual, thousands of pages of regulations and combing through them and keeping an eye on that. I dabble in everything.
Great. So the purpose of this episode is really to talk about the 10 new AI principles that you folks have worked on and that CHIME has launched. It's been highly publicized recently. But before we do that, I just want to try to get a feel for what the landscape is now in the government affairs sector. And Chelsea, this is counterintuitive to me. You said this is sort of regulatory season. I mean, this is prime time, and most of us in the rest of the world and other occupations say this is summertime. How could that be? And that there's nothing being done down there because it's the political mayhem that's going on and the election and everything. How would you characterize the landscape down there? And now I'm learning about the seasonality of it. I mean, this is really busy. Is that what you're saying?
Yeah, it's absolutely really busy, but there is a lot less going on, which is extremely typical for an election year. Mm-hmm. Wouldn't expect a lot of future movement on congressional efforts coming forward until the lame duck session, which is after the election and before the new Congress starts. But on the other hand, as I mentioned, the administration is full throttle. They're trying to get as much done on the regulatory side of things that they can.
What do you say, Mari?
Yeah, that's exactly right. I mean, Congress is much slower. All eyes are on the election. It is typically a time when the administration wants to cement their legacy. And so they start typically sending things out the door very quickly so that they can, again, spurn that up before the next administration change comes in. I will say, though, that the Supreme Court decision regarding the Chevron deference, really upended things. And we were expecting to see a little bit more action this summer, particularly around some cyber mandates. And that has slowed things down as the entire government is taking a fresh look at, what they send out and whether it's going to be like Chevron proof. Mm-hmm. So that's something that we've been wrestling with. And I mean, it's not to say that everything is completely stalled, but it has slowed down the momentum.
So I'm required to ask, as everybody does these days, you have to say something about AI, you have to say something about cybersecurity, but I almost have a fiduciary responsibility to ask how your world, or how you see your world or the world down there changing, no pun intended, as a result of change, ascension, and most recently, the Y2K, as people call it, of 2024 with the CrowdStrike.
I was just going to give the high level and let her dive deeper. It was, she and I both thought that there was a thinking that heading into this year it was going to be like AI all the time. And we were just going to, because that's what it was last year. You couldn't even have a conversation without saying AI. You'd be basically uncool and you didn't know what you're talking about. You just had AI, then you said extra cool. Exactly. So then we get to February 21st and the world completely changed and we had to pivot and try to fold in once again cybersecurity into our landscape. So I was just going to say that kind of changed our trajectory, but I'll hand it over to Chelsea to.
They're intrinsically linked, I think, cyber and AI, which is why it's one of our principles. So there's overlap there, significant overlap in a lot of reasons, which we can chat about more. think you were trying to, correct me if I'm wrong, get at what's going to happen maybe on the Hill as far as like these cyber incidents. And to be honest, there are just precious few days left between now, the end of the current continuing resolution and appropriations needing to be passed, or another continuing resolution to keep the government funded and take it back September 9th. They have until September 30th to do that. And then there is not a whole lot of time between then and the election. So as far as hearings on cyber, nothing is set in stone. I would be surprised if we had a lot of substantive hearings on that.
Really, even the CrowdStrike thing. How did this? Folks must have been on the organizing committee or in some way involved, if not yourself, developing these principles. I mean, how did this incubate within CHIME? Somebody said we need principles. I mean, how do you start this process?
It was December of 2022 when ChatGPT really started to emerge on the scene. And so we, like others, were starting to pay attention to this novel, groundbreaking technology. And it caused everyone to sort of pause for a moment and say, well, what are the implications for healthcare? It was so enormous, though. Like all these groups started forming. It was like a lot of norming storming. I don't know. And everyone was just trying to get their arms around this. And so we took a lot of time. I mean, I'll let Chelsea talk about what she's done personally, but she's done a tremendous amount of work behind the scenes. We were surveying the landscape and just saying, like, let's figure out what's going on with stakeholder engagement. Let's figure out what's going on at the legislative level. Let's figure out what the administration is doing. So we spent last year just doing a landscape analysis, and then we just deduced that, as we got in more and more questions that we needed to have a set of principles. But it was a very thoughtful process. So we went through our policy steering committee and deliberated. But I know that Chelsea has a lot to add because there were rules. There was like a lot of like nitty gritty too that we were wrestling with.
Yeah, the HTI 1 rule from the formerly known ONC, now ASTP, was a lot. And it included a lot of pieces on AI in the program, in the certification program, and just kind of figuring out the impact on our members took quite a good chunk of our time. So then, coming out with these principles involved a lot of like, there's a need. And fortunately, we have access to the thought leaders and subject matter experts because they're our members. So, kind of picking their brains about things. And it was really a collaborative, although lengthy process and very thoughtful and deliberate. And I think what we came up with, it was hard to whittle it down to just 10, but
I can imagine. That's what I was surprised at, because I've done this before with like corporate values. Some of the greatest wars of all time have been fought coming up with 5 corporate values when there could be 505. So I can only imagine when you have principles related to AI that everybody has their own take. And there, as we said prior to the call, there's a lot of these that are complementary, that it's not just one principle, that everything links with the others. How do you see those of us in CHIME and outside socializing these principles? I mean, you do it, and then you have the principal party, like everybody does high fives. We've got our principles now, and then it's like, now what do we do? So what's the now what do we do part look like?
Well, if you want to dive past the first 2 pages where we have them encapsulated, just summarize quickly, you're going to see a series of recommendations. The set of principles is aimed, it's really more for the policymakers. I mean, certainly our members can open this up, but it's really designed to give some direction to lawmakers and the administration about where we think they need to go. So you actually wouldn't be terribly surprised at some of the things we've asked for. We continue to ask for a national privacy law. I know that's not going to happen this year, but it's needed because all this data, I mean, I don't even know. I'm not even sure how many zeros come to the end or like what the word is, how big all the AI data will be, but it's so enormous. We need to manage that from a privacy standpoint. So that's like one of our core values inside of the principles. There's also things about burden. I mean, there's only so much that providers can handle, right? So any efficiency, that's been something Chelsea's been super focused on, is like any efficiency we can bring. We don't want some duplicity in the government. We have enough of that. We don't need any more of that. Thank you, but no thank you. So there's going to be things in there that really build upon a lot of years of work. And then there may be some new things. For example, I mean, we're positing, we're not saying definitely do this, but definitely explore start getting any kickback. Donations. Maybe they did cyber donations. That was new. They did EHR donations way back when, right? Nobody really uses the cyber donation flexibility, but maybe there needs to be AI donations. As they're asking us, I mean, tell us they can talk about this. They're asking us like, hey, what does CHIME think? What do your members need?
They absolutely have, which is it's nice and it's good that they're reaching out to us, the administration, and coming to us as thought leaders and asking, well, what are the challenges our members are facing? I really think they're coming from a good place. They don't want to, stifle innovation. They want to know what the challenges we're facing, what's keeping our members up at night. And we have a laundry list of things to share with them and have shared with them. So it's sort of an ongoing dialogue. It's an iterative process where we're just continually, like, AI is changing all the time. And therefore our messaging to policymakers, these are the core messages, and they kind of have grown with some subgroups with, things like third-party sales tactics. Just they've kind of out that are not encompassed necessarily in the principles, but they could grow in the future and have additional things. And we're workshopping some ideas on other collateral that we can offer our members that would be helpful to them.
That's very helpful. Last structural question. How did in CHIME, we call them foundation members, but how did the vendors or partners, as some people like to call them, factor into determining the priorities, if at all?
Well, we actually take a lot of phone calls from vendors and other industry stakeholders. It's actually an important part of our work.
I would think.
Chelsea maintains ongoing relationships, for example, with the EHR vendors. We talk to device manufacturers. We talk to big tech, hear what they think. We want to understand their position. It doesn't mean we're going to always agree with them, but we do want to understand. We want to have a full understanding of the environment before we arrive at a decision. And they're important. I mean, they're the products that our members are buying. So they are important stakeholders. At the end of the day, though, we are the voice of the provider member. And so we speak on behalf of the trees. No, I'm kidding. We speak on behalf of the CIOs. So we're their voice in Washington.
Great. So without further ado, I want to start jumping into these. And I took the liberty of giving him Frank's priorities, the ones that he thinks are the most important. But I think the rubber hits the road at patient safety and surely outcomes. Patient safety is way up there near the top, I would think.
It's the first. And it's the first for a reason. It is the first principle because patient safety is the most important thing to our members. At the end of the day, it's all about patient safety. They're facing a lot of other challenges as they approach safe, responsible, and ethical use of AI in their organization. It's including cybersecurity, data protection, identifying and mitigating potential AI biases in models and training data, educating their clinicians, costs, return on investment. Across all of these challenges, though, patient safety is always top of mind.
Anything to add, Mark?
I mean, building on that, cybersecurity is patient safety. Everything is safety, right? When you're implementing new technology, you want to make sure that in the process of improving something, you're not breaking something else. It's so important, but there's so many ways that we see that there could be AI value add. I mean, one thing would be the continuum of care, right? So the government could help develop some use cases and help the middle of the pack, right? The average hospital system who's not necessarily at the forefront, who's not an early adopter, they could help them try to deploy some use cases. And we could all decide what those use cases are, but why don't we start with the ones where we know that there's systemic issues? And a lot of these are based upon patient safety. If you don't have the medication list when you transfer a patient, how is that safe, right? I mean, if you have a medical device compromised, how is that safe? So safety, just to reiterate what Chelsea said, it's really baked into everything that our members do.
Patient safety is related to health literacy as well. And AI, especially generative AI, is part and parcel of one of the solutions and surely one of the problems in terms of health literacy, which equates to patient safety. It's a very difficult thing to solve because it's the new shiny object for patients. It's replaced Dr. Google in a way, but it's showing up on our phone. We can't even get to our regular search because now we have Genesis popping up before we get to the other thing that we were used to. So I'm just curious, and I would add that patient safety and health literacy are inseparable in a world of generative AI.
I mean, I'm sure that maybe there's a principles update that we do next year. I'm not sure, but I think literacy, there's both, the consumer patient literacy, right? There can be low level of literacy on the patient side, but then there's also like the provider side. And since we're approaching this through the provider lens, indeed, you're absolutely right that there needs to be a learning period, right? You can't just go, for example, you could be violating privacy if you're using tools like on your own personal device. You don't want to do that. You don't want to be putting IP into the large language models and sharing information that shouldn't be shared. So there is actually a level, you're absolutely right. There's a very high level of literacy that comes with this. And so the entire provider system has to be trained on it. And we're still we're inching our way. It's like there's micro and macro. We each individually need to learn how to deploy AI in our own lives. But then we also, from an organizational standpoint, need to know how to like deploy that organizationally. There's a lot of literacy here.
I want to jump on to the next one, which was really the one that I thought was second. And then it made complete sense when we looked at affordability first and then discrimination, bias, and equity, because again, you say them in one breath usually, because if you can't afford it, you're
not worried about
you're part of the digital divide. Obviously, came up pretty high on your list of priorities.
Yeah, I think our members have expressed a lot of excitement and concerns, valid concerns about the speed and promises of AI and the things that they can do. But the reality is that, as Mari mentioned, our mid-sized members, even those that you might think would be on top of this, are not able to afford right now any AI tools. They might be purchasing them through their EHR vendor or something that they know is validated, safe, they trust, they have that relationship with their vendor, and they are just right now, they're not developing their own LLMs. They're not. They don't have the people, the bandwidth, the time, the money. And you have to really calculate that return on investment. The initial investments are extremely high for our members. So they're being very cautious and careful. And meanwhile, IT budgets are getting slashed. So that doesn't help anything. And there's competing costs with other priorities, which I'm sure Mari will hop in on.
Yeah, the costs are a real issue. We're worried that unless you're tethered, say, to like a large academic medical center that has the resources to deploy these tools, that the digital divide will widen even further. And so it doesn't necessarily have to be rural America, but like underserved areas, areas where there isn't, again, like a proximity to a large academic medical center, middle of America. I mean, you can think of all these places, these pockets. I mean, we joke about my broadband, but I'm only 40 miles outside of DC. So we need to bring back to patient safety and patient care. Every patient deserves to have like the best healthcare experience. But if only the cutting edge tools are available in pockets of the country, then what's going to happen is the digital divide will widen. So we need to have broadband everywhere. So really, as you said, Frank, they're all intertwined.
I think it goes back again from a consumerism point of view, that when you say that many of these providers can't afford it, the consumer, as naive as they might be, not even a patient, but a consumer would say, well, I have it on my phone. Why can't my provider afford it? I think that's part of the consumer wondering what degree it is being deployed. And it goes back to another debate with AI, which I don't know where it falls in here, but it could fall into all of them. How much right does the patient know that AI is being used in their care and their outcomes?
So there needs to be some awareness around that.
I mean, I think you have clinicians that went to school, like a pediatric neurosurgeon, not to pick on them. They're wonderful. They're gems. There aren't that many of them. They went to school for 17 years to do what they do. And they're using AI or not, it is just going to, again, as we said, augment clinical decision making. And it's usually happening right now in the larger academic medical settings. And they're doing their best. They've got governance policies in place, we've heard, and we just don't want to see anything coming from the policymakers that's going to stifle that, where they're being really careful. They have the resources to do this thoughtfully. I mean, my veterinarian uses ambient listening. So I take my
nuance, right?
And I was like, let me see how this works. And it's really cool stuff. So HIPAA doesn't apply to them. So that's why you could have it on your phone, but your doctor might not have it on their phone.
And your dog has a patient identifier when we don't.
So most of our members are not using it for clinical purposes, Frank. in terms of transparency, I don't know that they necessarily need to know that the ED, for example, was staffed with the help of AI. Do they really need to know?
Oh, I agree. No, they don't need to know. They don't need to know that robotic process automation is being used for mundane tasks.
Right. So, I mean, since most of our members are not yet into the clinical space, I think transparency is, of course, important, but we need to focus on ensuring first that again, most can adopt the tools, even if it's from a workflow efficiency standpoint. Certainly the ones who are, again, who are first movers need to be transparent with how they're using it. But most of our members that we've talked to, and we've had several regional roundups and feedback sessions, and what I was going to say too is that the Most Wired survey from last year, I'm sure the data, which is coming out for this coming year, it will be interesting to look at the difference, the shift, and how AI is being used. But the data from last year indicates that most are using it for administrative processes and not using it for clinical.
But I got to muscle my way back in on the equity part, because there is implicit bias in a lot of these things where a Chihuahua is being confused with a blueberry muffin in terms of facial recognition. That's true. You could look it up. So I'm just wondering how that, even though you wanted affordability higher, there is that bias and equity part of this that I'm sure when the government gets involved, it's going to be some serious debates.
I think our members are super cognizant of the flaws that are inherent in some of these tools, right? So hearing from a member that in their gender lab, the AI tool that they were, kind of trialing to help the developer, just assigned gender based if they thought the name was male or female. And they had to go through and manually change everything to the preferred pronouns.
Right.
And that's just not helpful. So there are definitely biases that need to be worked out, but there's time and with input from providers that are using these tools, they can be fixed, but you put in garbage, you get out garbage.
There you go. So this was a 2-inch putt. I mean, the cybersecurity and AI priority. We could do a 2-day conference on this, but could you capsulize where you see the most prolific integration of those two? So how are you characterizing that broad area of cybersecurity, or how in the world that I live in, I tell people you have to add hyphens to it. What hyphens will we add to cybersecurity that really magnify the priorities that you have in the list?
First thing that comes to mind is there's competing needs, interests, and budgets that are this and then becoming this, just shrinking. And what are you going to prioritize? Cybersecurity or investments in AI or a little bit of both? Are they going to fix an elevator that's broken, or are they going to work on renewing their cyber insurance?
Yeah, and the extreme pressure that CFOs are putting on to have cybersecurity become a revenue center. It's not an expense, but how are we generating revenue from this? What do you think about the cybersecurity aspect, Mari?
What I think is you got to do it. I know that we hear sometimes internally there can be pushback within an organization because of limited resources, but cybersecurity is not going to go away. And I think it's going to continue to be a real pain point. It's going to continue to collide with AI because of the opportunity. The data is so rich. So I don't see how you can go wrong by adopting best practices. It doesn't mean you need to do everything all at once, but it is a journey without, an end destination. Cybersecurity isn't static. If you want to be the one whose system goes down for 2 months, talk to our CISOs, who actually have been through this, and the downtime is so disruptive. Again, patient safety. Do you want to be down for a cyber incident? You're going to go on diversion? I think there's a lot of more upsides than downsides.
Sure. I mean, in cybersecurity and AI are co-evolving. You can't have one without the other. I mean, the arms race in cybersecurity is based on people using AI, the bad guys using AI to stay one step ahead in the arms race. So, I mean, they're inseparable. That's why the governance of AI and cybersecurity have to co-evolve, because it's not like, maybe I'll do cybersecurity and maybe I'll do AI. No, it's the same. Now, the last one with the time we have probably 8 more to go, and we could probably do 2 more days, but that would be fun to do again. Do we have anybody here in the group that could speak about the regulatory oversight and the priorities? Anybody know anything about that in this group?
We get that regulatory oversight is needed, but it needs to be done, especially with AI, in a thoughtful way. And we do believe that healthcare is a special unicorn that deserves special treatment because it involves patient lives. Healthcare costs are out of control. There are ways that it can be used to reduce costs in just the administrative side of things, billions of dollars. So we just want to be careful that we're not stifling innovation and that we are, any sort of either regulations, policies, frameworks that are put forth are done so in consult with us, with other stakeholders, with those that are on the front lines using this, developing them, and that they're thoughtful and not rushing.
Are there big wins in this area that are bipartisan? I mean, without the bickering. I mean, we saw TikTok being bipartisan in a way. I don't know what the outcome will ever be, but we'll find out. But there seems to be bipartisan displeasure with it, and some on the other side. Are there bipartisan issues that you think could be quick wins? Let me ask you in a different way. If you had to look back over the last year or so, is there anything where there's a shocking amount of agreement of getting some of these regulatory issues through?
It's really hard to get things done here because you need a certain number of people that support it, and then you have one person who doesn't, and then it just doesn't get done, and then on to the next session.
So those are the ones that I picked. I mean, you're saying here's one last closing priority that I think we have to talk to. Not that the others aren't important, and we would encourage people, and we will put up on our site here where you can get these priorities and look at it deeper. Anything else you want to add? So what should we add here?
I love that. I love your analogy, policy CrossFit. Sometimes there's this image that I've seen before where it's a picture of a woman pushing a boulder up a mountain. And sometimes it feels like public policy is pushing a boulder up a mountain on certain issues in particular. Mm-hmm. I think there'll be, we need to get past the election, honestly, if I'm being honest. Like, that is what the priority is in Washington. We've got to get past the election. And then once we can start with a clean slate in January, whichever administration is, then there will real work. I mean, there will be an end of the year package. Absolutely. There'll be some rules in between, like maybe HIPAA, but it's going to be a clean slate in January, and we're going to have to start all over again. And that is, honestly, I know that's sad. People might think, well, there's not like a lot to be done. There'll be some dog and cat issues. They're going to have to try to get the funding done. We'll be commenting, Chelsea will be commenting on like the plethora of federal regulations. But at the end of the day, we have to get past the election.
But we're used to that. This is our life.
It's your occupational hazard, right?
It's one of the perks and one of the, downsides of the job is every 2 and 4 years we go through this. And I've worked through 8 years of one administration, 4 years of another, 4 years of another, and it's different and still the same at every November.
That's what we do. Why we do what we do. Well, it's always a thrill. The conversation's not over. We'll have plenty to talk about again after the election in the beginning of next year, after the inauguration, whoever it might be. So I just want to thank you guys again. I love the work you do. I really greatly appreciated on behalf of myself personally and on CHIME. And I'd like to thank our listeners for tuning in to Health Stealth Radio, and we'll look forward to seeing you next week for our next episode. Thank you so much.
Thanks, Frank.
Thank you for joining us today in the shadows for this episode of Health Stealth Radio with Frank Cutitta. If you like the program, please be sure to share your comments on our social media sites, or feel free to contact us with suggestions for new and stealthy show themes. We look forward to welcoming you again for our next broadcast. In the meantime, stay safe out there.